Hello, welcome back to The Remedy, brought to you by Coos Health and Wellness. I'm Eric Gleason. Today we are going to discuss South Coast overdose prevention, and we are joined by Kate Frame, the Prescription Drug Overdose Prevention Coordinator.
Long title.
That is. Thank you for joining us, Kate.
Thanks.
So, what is the South Coast Overdose Prevention Project?
The South Coast Overdose Prevention Project is a project funded by Oregon Health Authority, and it's housed at Advanced Health, our coordinated care organization for Coos and Curry counties. And the goal of that project is to reduce the harms related to drug use. So overdoses, other types of harms like HIV infection, the burden of addiction and substance use disorder. So really looking at all of the different factors related to substance use and the impact that it has in the community, and working with community partners and sort of this interdisciplinary team to reduce those harms.
Wow.
Yeah.
That's, well, now that, I mean, based on everything that's happening, that's a needed service.
It definitely is. And Coos County is one of the highest burden regions in the state for opioid use, the impacts of opioids. So we have a really high overdose hospitalization rate. So it was much needed.
So, speaking of opioids, what specifically is an opioid?
So opioids are a class of drugs that include heroin, they include synthetic opioids like fentanyl, and they also include prescribed opioids like oxycodone or OxyContin is the brand name, hydrocodone, those things like that.
Fentanyl is a huge issue right now. You see it just about, you can't turn on the news without seeing something to do with fentanyl and deaths related to fentanyl.
It's extremely potent, and the issue around fentanyl is that it's showing up in black tar heroin, it's showing up in meth and cocaine, in weed, so people could think that they're using a normal amount of something and it will be laced with fentanyl, and people are overdosing at a really high rate because of it.
So who is at risk for overdose?
Well, actually anyone who uses opioids is at risk of overdose, even if they're using them as prescribed by their doctor.
Wow.
So the reason that opioids pose such a high risk for overdose is that they cause depression of breathing. So if somebody begins to overdose on an opioid, there's a really short window of time where their life can be saved because their breathing will stop. So that's why we're really wanting to encourage people to carry naloxone, the overdose reversal medication, because it will actually bind to the opioid receptors in a person's brain and kick the opioid off of those receptors long enough for that person to get medical attention. And you have a very short window of time to do that. So we want people to have it ready and know how to use it.
Right, so you need to be on the ball when it comes to administering that.
Yeah.
So as far as community members, what can we do to help?
So there's lots of things that the community can do to sort of combat the opioid crisis here in the community. One of those things is being an informed consumer. Know what you're putting in your body. Know the risks to what you're taking, even if it's prescribed by your doctor. Talk to your doctor about other options. Also, be wary of your children, and we always say keep the opiate naive. If your kids don't need to be on an opioid for a broken arm or something, then keep that in mind. Ask your healthcare provider for other options. Carry naloxone and know how to use it. And there are multiple places that someone can get naloxone. They can walk into the pharmacy and get it from a pharmacist right now. And OHP will cover it. And if someone has insurance, then they'll maybe have to pay a copay. And we want people to safely dispose of their medications. Don't flush them. Take them to Coos Bay and North Bend police departments. There are medication drop boxes.
All right. So if anybody were to have questions, they can contact you?
They could, yes.
Or we'll put Kate's information up on the screen, and if you have questions regarding this, maybe you know someone, or you might yourself have some issues that you want to get some answers for, reach out to Kate and her group. I know that she's working with a bunch of community professionals in this area and trying to make some real change happen. So thank you for that, Kate. For the Remedy and Coos Health and Wellness, again, I'm Eric Gleason. Thanks for joining us.